This video will cover sideroblastic anemia, which may lead to disorders of marrow production. To anchor us to sideroblastic anemia, let's start by first appreciating the painting on the wall. That fish looks a lot like Nemo from a famous children's movie, and it looks like he's got some cider that he'll be enjoying soon. Nemo represents anemia, and cider represents sideroblastic. The red blood cells in this disease are expected to be hypochromic, and they may be microcytic, normocytic, or macrocytic. Since there is variability in the MCV, it will not be represented in this video. The MCHC, however, will have a prompt for us to remember that it is expected to be low since the RBCs are hypochromic. You see the macho action figure on display? Macho, if shortened, can get us to MCHC, right? And since action figures are harmless, we'll remember that the MCHC is expected to be low. Additionally, you could even say this character looks a little bit like a short king, right? That might be an extra way of remembering low MCHC. Importantly, some other prompts in this video will be placed on these shelves as a way for us to remember that they are elevated, so please don't confuse this action figure as being a representation for high MCHC. Let's move on. This attending must be cool because I've never seen an attending wear a polka dot shirt like that. His shirt represents basophilic stippling, which may be seen in the red blood cells in this disease. Since we're talking about red blood cell inclusions, let's look at the patient's t-shirt and what she's saying. She's saying she's here for her PAP, which will be a symbol for Pappenheimer bodies, and her shirt only has a couple of polka dots. If you haven't seen Pappenheimer bodies, go look them up. It looks kind of like her shirt. Another characteristic microscopic finding in these patients are ringed sideroblasts in the bone marrow. Bone marrow is represented by what looks to be like a Bloody Mary the doctor is enjoying. It's even got a bone in it as a stirrer. Because Mary from Bloody Mary sounds like marrow, and because there is a ring placed next to the drink, we can put this all together to remember ringed sideroblasts. The dumbbells right next to the drink represent increased iron stores in the bone marrow, another characteristic finding. And since there are two dumbbells, which I personally think is very excessive for this doctor to have on his desk, we can remember that iron stores are increased. The third and last characteristic finding in the bone marrow is erythroid hyperplasia, which is represented by this little red blood cell who somehow became this big. Some crazy hyperplasia must have happened. Moving on to some more of this doctor's interesting office decor. This trampoline with static electricity represents transferrin saturation, since transferrin sounds like trampoline and saturation sounds like static. Since it's being displayed up high on the shelf, we'll remember that the transferrin saturation should be high. The bat next to a tin can represents ferritin because bats are blood-sucking, which will remind us we're referring to a protein in blood. And tin can sounds like ferritin, doesn't it? The ferritin in these patients is expected to be high, which is why the bat and tin can are placed up on this shelf. Our patient brought with her a medal today. The medal with the red ribbon is a representation of intramedullary hemolysis. Medullary sounds like metal, and the ribbon is red for us to remember hemolysis. Intramedullary hemolysis refers to premature destruction of RBC precursors within the bone marrow, and it is a key feature of sideroblastic anemia, where the body struggles to incorporate iron into hemoglobin, leading to the formation of ringed sideroblasts and ineffective erythropoiesis. Moving on to the causes of this disease. Most commonly, sideroblastic anemia is acquired, but rarely it can be inherited in an X-linked recessive manner. The railroad crossing sign here represents X-linked. Additionally, since this sign looks a little abnormally small, we'll remember recessive. Did you notice the doctor's name? Dr. Pearson Pancreas. That's a good one. I'm not even kidding when I say that's not the most unique doctor name I've seen. I won't name drop though, that would be rude. Pearson here represents Pearson syndrome, which is inherited sideroblastic anemia with pancreatic insufficiency. The happy meal here is a way for us to remember myelodysplastic syndrome, often shortened as MDS, with SF3B1 mutation, which is one of the ways in which sideroblastic anemia is acquired. MDS sounds like the name of this restaurant, right? And since the meal comes with a toy straight from San Francisco, we'll remember SF3B1. Medications are another way in which sideroblastic anemia can develop. The two most well-known medications are chloramphenicol and isoniazid. They are both represented by this big green labeled medication bottle. The green color will remind us of chloramphenicol because chlorophyll is a green pigment in plants, and it sounds similar to chloramphenicol. Isoniazid is often abbreviated as INH, and it's right there on the label of the bottle. It looks like our doctor here is an oncologist. Oncology will serve as a reminder of radiation and chemotherapy, which are two more ways in which a patient may develop sideroblastic anemia. We're finally reaching the end here. I don't know why this patient decided to bring a copper wire to her appointment, but for us it's very convenient because it represents copper deficiency. Copper deficiency is yet another cause of acquired sideroblastic anemia. Honestly, if you made it through all of this, I'm surprised. Good job. The last way of developing acquired sideroblastic anemia that we'll talk about here is through alcohol abuse. I mean, again, this doctor is literally drinking a Bloody Mary while seeing a patient. Do I really need to disclose here that I do not condone this behavior, or is that obvious? Please be sober when at work.